Hi, I'm Rick Kaler. Thanks for joining me. I recently talked with an administrator of a private medical practice about some of the financial challenges she faces in dealing with the medical system, insurers, and their patients. Some of the insights that she gave me into the realities that private physicians face in providing the medical care to people were pretty disturbing to me. Here are a few of the things she shared with me. I'll start with the insurers, who account for the bulk of their revenue. Many payments for procedures from insurance companies, which would include Medicare, are below the cost of providing the service. This forces them to make up the difference on other procedures or find other sources of income to sustain the profitability of the practice. Conversely, in markets that have just one hospital, the insurance companies have no leverage. If the insurers won't pay what the hospitals demand, the hospitals can threaten to drop out of the network, leaving the insurers with nowhere to send their insureds in those markets. The insurers end up agreeing to pay the hospitals more. And charges for services provided in-house at the hospital can end up being substantially higher than those same services done by outside providers. She gave me an example of a lab test that cost $1,500 to $2,000 at the hospital, but $35 to $80 at an independent lab. Now, that was pretty shocking. Of course, patients do have the option to direct the hospital to use an independent lab, but how many people really know that? And how many will have the presence of mind to make that request? Well, it makes financial sense to price shop if you have a high deductible like an HSA plan. There isn't much incentive if your plan has a low deductible. Another challenge is collecting from patients. She says, and I think maybe a little bit tongue-in-cheek, that a surprising percentage of Americans maintain checking accounts with no money or keep checks from accounts which have long been closed. While writing bad checks is a crime, those who game the system know that they can probably get by with writing a low-dollar check because the cost of pursuing justice is much more than what the check is worth. Most companies would never do business with this type of person again. Healthcare professionals tend to have a bias toward giving everyone services. So these same people do return requesting care. And she said that her physician employer and she have had huge internal arguments about this. Her position is that these people take advantage of the physician in a premeditated fashion and don't deserve to be extended services. Her physician argues that everyone, even deadbeats, deserve health care. Since the practice doesn't provide life and death services, she was able to get the physician to agree that if someone has an outstanding bill, they need to settle it up front in cash before any new services are provided. Then there are those who use credit cards and fraudulently dispute the charges. Some providers let this go because of the difficulty of proving that the charge is legitimate. To do so requires photographs of the customers during the transaction, copies of the driver's license, customers' signatures on the paperwork, and notarized statements from the provider verifying that this was the person who received services and presented the credit card. Good grief. A final interesting point concerned patients' Social Security numbers. She said the only time these are ever needed is when an outstanding bill is sent for collection. Otherwise, they're never accessed or used. She was quick to add that only a small fraction of their patients premeditate stealing from them. She also stressed that not all insurance companies or hospitals behave unethically, and some do wonderful, humane acts of kindness. Nevertheless, the lack of integrity that does occur on both sides is infuriating and adds costs to the healthcare services that you and I pay for. Thanks for listening.